Senior Moments is brought to you in part by Rogers City Rehabilitation Hospital, Hillman's Haven, Alpena Cab, Alpena Medical Arts, and Wenzel Bennett and Harris PC.
Depression and anxiety, two medical disorders that are often interchanged but really are very different.
Depression tends to be more feelings of sadness, whereas anxiety tends to be more excessive worries or feeling nervous.
Depression and anxiety aren't like other conditions we've discussed on Senior Moments. It's difficult for physicians to diagnose patients with medical disorders that aren't easy to spot at routine examinations. But Dr. Worth says since these are disorders that affect a large percentage of the population, medical personnel are on the lookout.
In the general population, depression and anxiety affect approximately 12% of men and up to 25% of women. Now, when you're talking about older individuals, geriatric patients or patients over the age of 60 who are hospitalized can have rates of depression as high as 30%. So it's something that nurses, physicians are continually paying attention to and screening for.
In terms of symptoms for depression and anxiety, Worth says there are two kinds of warning signs.
They cause a variety of both psychological and physical symptoms. These symptoms last for at least 2 weeks and tend to interfere with daily activities and relationships. People's ability to function, to go to work, to take care of things that they need to do, it may be taking care of children, taking care of a spouse, feelings of sadness, loss of interest in normal activities, hopelessness, feelings of guilt, excessive worries.
Worth says people diagnosed with other chronic conditions are at the highest risk of diagnosis of depression or anxiety. While medication is an avenue for treatment, Dr. Worth discusses other options.
Definitely counseling, going to a licensed therapist to learn coping techniques, addressing any underlying issues that may be adding to the depression or anxiety, and then light therapy is also used.
Worth says a visit to your primary care physician is the first step in getting help.
Senior Moments has been brought to you by Thunder Bay Therapy, ARMC Rehabilitation Services, Lafarge, Alpena Senior Citizen Center, and Lincoln Haven. Senior Moments, Thursdays at 6 and 11.